two.
Good evening. Welcome to the Community Awareness Committee's September panel discussion. Our topic this evening is senior safety. I am Trish Steiner, Chair of the Community Awareness Committee. For those of you joining us for the first time, the Community Awareness Committee is a committee of the Neighborhood Safety Commission. The Neighborhood Safety Commission is comprised of 15 individuals appointed by the chairman and the district commissioners. We welcome you and thank you for attending this evening, and welcome those of you who are watching on TV 23. Our committee members are Vicki Plunkett, Pearl Roberts, and Joel Cope. We have file cards available for written questions. Please turn your cell phones off or on silent, as your phone will interfere with the broadcasting of this discussion this evening. Thank you. Our moderator this evening is Kim McCoy, Director of the Our moderator is Kim McCoy, Director of the Victims Witness Unit, Office of the District Attorney. We especially want to thank Kim for being our phenomenal moderator. Kim will introduce our distinguished panel members.
Thank you, Trish, and good evening to our panel members, to our audience, and to our audience watching us on TV this evening. As Trish said, I'm Kim McCoy with the District Attorney's Office. In my role as an advocate with the District Attorney's Office, we commonly deal with seniors as victims, and so we see the needs from the back end of when cases arise out of criminal actions. But our office is also very involved in the community at large with senior issues as well. So we're excited to have our panel this evening. We know and recognize that there's been many discussions and events around Cobb County lately regarding senior issues and elder care and elder abuse issues, but we have a little bit of a different perspective tonight with our panel members, and so we're going to be sharing some information that might be new to some people but might be just a little bit more in depth than what we've seen before. So we appreciate your time this evening. We appreciate you being with us. And I'm excited to introduce our panel members. So if you don't mind, I'm going to turn it over to the panelists and ask you to introduce yourself. Tell us who you are, tell us where you work, and what your role is, and just a brief overview of your agency, if you will.
I am Allison Hall, and I have been in the aging services for close to 10 years. I am currently program specialist with Cobb County Senior Services, and I'm very excited to be here tonight. Thank you.
I'm Danielle Humphrey, and I am one of the two attorneys at Hurley Elder Care Law here in Cobb County, and we specialize in seniors and taking care of them.
Good evening. I'm Sharima Young, Associate State Director with AARP Georgia, and I represent the 50-plus population. We are a nonprofit that has the 50-plus population's best interest in mind. We focus on community outreach and advocacy across the nation, but particularly here in the state of Georgia.
Thank you, ladies, again, for being here this evening, for taking time out of your busy schedule, and for sharing the information that is going to be forthcoming with our audience about senior issues. So the first question that I'm going to pose, I'm going to throw the question out there and give each of you a few minutes to kind of expand on that from your agency's perspective. And the question is, what does senior care, senior services, and or senior protection mean to your individual agency? So Allison, since you're in the first seat,
Okay.
We're going to start with you.
Great. In Cobb Senior Services, we service seniors of Cobb County that are 55 and over. We offer a variety of services and programs that with the goal of helping seniors to age in place with as many resources as possible to keep them active and healthy.
Great. And in a few minutes, I'm going to ask you to explain some of your programs. So
Sure.
I know there's a long list, but
Yes.
we'll come back to that in just a few minutes.
Great.
Okay. Thank you. Danielle?
At Hurley Elder Care Law, we help seniors find, get, and pay for good long-term care. We also do their powers of attorney and other estate planning documents that are real important as we age to protect us and to make sure we have somebody in place to take care of us and to take care of our finances as we age. I also do guardianships and conservatorships for people who lose capacity and don't have documents in place and need someone to take care of them.
Thank you. Sharima?
Yes, at AARP, we focus on making sure we empower our members as well as the 50 plus population. And we do that through a lot of education and training and outreach, but we also do it at the Capitol. So we lobby on behalf of the 50 plus population when it comes to issues such as caregiving, as well as fraud and financial security. Our whole mission is really based on making sure that people as they age can be independent and can live independently with dignity. And so that was the whole purpose of us being founded, is to ensure that people as they age will be able to do that.
Great. I'm going to stay with you for just a second.
Sure.
Is AARP a member organization? And so tell us how we become involved with AARP.
So we are a member organization, and we're a social mission organization. And most people don't know that because they see a lot of our commercials and they have some misconceptions about who we are. They may think we're an insurance company, but that helps to fuel our social mission. And basically, we have a $16 membership fee that allows our members discounts. But on the back end of that is the crux of who we are, which is our social mission, which is to educate, empower, and to advocate on behalf of the 50 plus population. So when we talk about issues of care, like caregiving, like long-term care, whether or not people have enough retirement savings, whether or not Social Security will be around not only for them but for their children and grandchildren, all of those things are important to us. So we're always keeping a pulse of what's happening with the latest statistics when it comes to our policy and research, but also when it comes to the policies that are in place. So we're also staying abreast of that as well.
Great. Thank you. And Danielle, obviously with legal services, someone would come to you because they need a service from you. So you've talked a little bit about what you do. Can you tell us some specific services? And then AARP talks about the threshold of age 50. Do you have an age requirement?
Most of our clients are the adult children coming in with their aging parents. So I'm dealing with people my age, and I'm dealing with people my mother's age. We don't have a threshold, a cutoff, but generally speaking, we're dealing with people who are getting to a point in their life where they need help and they need assistance. And hopefully, in a lot of cases they don't, but hopefully they have either some sort of family to help them. And they come in to us to, like I said, to figure out a plan. Maybe we've gotten a bad diagnosis. Maybe we've noticed that mom or dad or aunt or uncle or grandma has having some memory issues. They've done some things. They've forgotten to pay some bills. They've left a pot on the stove and it's burned. There's a number of things that happen. They are tripping and falling, and they're in a rehab center. And so now we've got to make some hard decisions about going forward. Hopefully, people come to us before that to put a plan in place before they're in a crisis situation. That's ideally like when we want to see our clients, that everybody has a plan in place before then. But unfortunately, that doesn't happen. A lot of times I get guardianships and conservatorships because there have been some financial abuse or physical abuse by either, unfortunately, a loved one, a caregiver, somebody in the neighborhood, or a stranger, and now we have to come in and protect them.
Great. Thank you for giving that detail. And Allison, same with you. How would a senior get involved with your organization, and do you have opportunities for those who are not seniors who want to be involved with your organization?
Of course, in senior services, we serve seniors 55 and over on a variety of scales. We have our multipurpose center and our wellness center that serves seniors that are very active. They come in and participate in various activities, seminars throughout the year. Then we also have homebound services and transportation services for seniors that need those services to maintain their lifestyle. As far as reaching out to the non-senior, we do encourage caregivers to come and participate in seminars and classes that we offer. In fact, we have a caregiving seminar that's going to be taking place at our Senior Wellness Center in October that we are encouraging, children, paid caregivers, anyone. It is open to anyone to come, and it is specifically on caregiving.
Excellent. Thank you. We do have a panelist who has joined us. We know traffic around Cobb County can be all sorts of fun, so we thank you, Ms. Helms, for being here. If you don't mind just taking a second to introduce yourself and your organization and a little bit about the role that your organization plays in senior issues.
Great, and thank you for having me. I'm with the Alzheimer's Association, and we serve people with Alzheimer's, we serve caregivers, and we also want to work with the public to help them know about things that they can do to manage the risk for getting Alzheimer's. So we like to work with them at even middle age when they can make a difference by managing their health in a manner that will help decrease the risk. But if a person does have memory loss, we want to help people understand the risk of not getting an evaluation, including what you mentioned in terms of financial exploitation. We're seeing that more people who have early Alzheimer's or other forms of dementia not yet diagnosed are prey to financial exploitation. And in fact, Vernon Keenan, director of the GBI, said that we're only seeing the tip of the iceberg. So we like to work with folks early on for a detection. And then once a person's diagnosed, we like to provide counseling as well as education to help the person live their best after a diagnosis. And then when the care partner is preparing to care for the person, we want to help them so that they can have the best quality of life, both for themselves and the person they're caring for. And then we try to do it all on the policy level too. So we engage the public, seniors, and others in our advocacy efforts, both on the state and the federal level.
Great, thank you. And I want to, you mentioned something about helping prepare people. I believe you said a lifestyle that will be less likely to have an Alzheimer's diagnosis.
That's right.
Explain that a little bit more,
Okay,
please.
on the worldwide level, mind you, researchers are looking at Alzheimer's in terms of what can we do to delay the onset of Alzheimer's, because if we can delay it by even 5 years, we can cut the number of cases of Alzheimer's in half. And so what research is showing us is that a healthy diet, a Mediterranean diet, will really help us, as will moderate exercise. And so that could be walking or any other thing that the individual likes to do that is really moderate exercise. We're not even saying rigorous, but moderate. And then other things that help are being socially engaged. So that means getting out and playing cards with your friends or doing other things to stay very active, going to the senior centers and dancing even. Those different things that bring them together with other people are very good for them. And then also engaging the brain. And so you could do the games on the internet like Luminosity, but you could also play bridge and different things like that. And all of those different things together with managing your cholesterol, blood pressure, and blood sugar and seeing a doctor regularly to monitor those things will help decrease the risk. And the exciting thing is too now is that Medicare covers a wellness visit annually, so people can talk to their doctors and they can now spit out a sheet for you that tells you all of the different things you can do to manage your health.
Excellent, thank you so much. Very good information for everybody, not just the senior population. I want to talk I do want to focus a little bit on abuse issues. And so I think, again, I'll just pose this question to everybody, and kind of from your perspective, you can tell us how you would advise someone if they came to you and said, I think that a family member, friend, neighbor is being abused physically, financially. We know sexual abuse occurs in the senior population, domestic violence occurs in the senior population. So if you don't mind, just take a second from your agency perspective and how would you direct someone coming to you with a concern of abuse?
From Cobb Senior Services, it's if you suspect something, you should perhaps report it. Here in Cobb County, we do have the Cobb Elder Abuse Task Force that has an anonymous hotline that you can call. But you never want to take that type of, suspicion lightly, ever.
Okay.
Well, we get the calls, we get the people who come in, and I want to get that senior away. I've gotten calls from seniors who are, I'm living with my son, he's brought his friends in, and they're, taken my stuff and I don't know what to do. Well, I want to tell her to call the cops. It's your house, but she doesn't want to do that on her son. So a lot of times we will try to find another person who can bring her in to our office, somebody who can help her to report it to APS, to report it to whatever, county they're living in. But mainly what happens is when they come to me, I try to get a guardianship or conservatorship over a guardianship to protect the person, the conservator to protect their money from whoever is financially abusing them. Because usually if it's somebody living in the house or a caregiver, a child, a nephew, niece, grandson, whoever's living in the house who is perhaps either physically abusing them or financially abusing them, we need to get them out of that situation, or we need to get that person out, but usually they're not strong enough to do that. If they were, they would have done it on their own. So we need to have somebody else in there to become their guardian and conservator who can act on their behalf, file a suit against that person, to get them evicted from the house, to get them from not being able, because usually they have some sort of fake power of attorney or something that they created online, and they're taking the money, or they've got the credit card, or those types of things. So we want to get that under control as soon as possible. And usually the only way to do that is to file a guardianship and conservatorship, which we have to do in the county where they reside.
Okay, thank you.
One of the things we focus on is fraud. So fraud is a huge program for us where we do a lot of outreach, and AARP has the Fraud Watch Network that is free to everybody. You don't have to be an AARP member. You don't have to be 50 plus. So it's a free resource for you to, number one, find out what the latest scams are when it comes to financial scams, but also how do you begin to protect yourself. And we have those tough conversations. So we do a lot of community outreach presentations at different venues like churches, like civic organizations, so that we can get the dialogue going. So when it comes to talking about the stranger that's trying to scam you, or talking about the relative that's trying to scam you out of your funds, how do you begin to protect yourself, and how do you say no? We have those difficult conversations. How do you say no to a grandchild or to a nephew? And you have to have those conversations, but sometimes it comes from the person that you don't know. So from an AARP staff person or a volunteer instead of your daughter, because you feel like you still have to be the adult, you're the parent. So what we find a lot of times is that when people have been a victim, they're ashamed to say it. So they're ashamed to tell their families about it, because they feel like they should have known better. So we're here to be that listening ear. We're here to be a resource. So we have the website. We have a toll-free number that they can call us to see if they are being scammed. Also, we have direct links to places or agencies like the Federal Trade Commission, the Governor's Office, as well as others, that they can get the necessary tools and information that they need. So those are some of the ways that we do that. One of the things I wanted to just go back to is you asked, how can you become involved? Well, we can't do what we do without our volunteers. So within the state of Georgia alone, we have a little over 300 volunteers that we train and equip to go into their own communities and provide this information. And they're very passionate about fraud and helping to protect others.
Very good, thank you.
At the Alzheimer's Association, we see this as one of the biggest challenges that people with Alzheimer's face. And so we're working on it from several different angles. And we actually hired the nation's expert on financial exploitation, which is Dr. Marson out of UAB, and he developed a screening for us, a tool that will ask questions so that someone, the law enforcement and adult protective services, could assess a person and find out if they have financial capacity or the ability to make the decisions about their money. Because like you all have said, we're seeing that people oftentimes aren't able to make the decision or the judgment that this isn't a good thing to do. And so what's really happening is that people early in memory loss, before there are enough symptoms to diagnose a form of dementia, are having changes in their brain that affect their judgment, and therefore they're easy prey for financial exploitation. And so because we're seeing this happening more, we feel like there needs to be a lot of awareness. And sometimes this is going on where, let's say, an older sister is being scammed by her son who's gone through a lot of her money through having his name on the checks or access to her credit cards, etc. We need people to recognize that making these bad decisions or decisions that aren't good for them, where the money isn't there to care for them, is going on. We need them to see those as the red flags. So we need them to, be looking out for those you care about. If you see these odd things going on where they're giving their money away to family members or to, internet scams, people need to look into that early. One case I know of, a man went through over a couple $1 million before the wife knew that there was a problem. And it was a trusting wife who thought he's handled the money all of this time. So my point is we need a whole lot more awareness about it. And then when something is going on, we need to take action. And like she said, a lot of times elders are embarrassed because they don't want to admit there was a problem, or it's because a family member was good to them, or they're the only one that visits, etc. And so they need help, and they need to reach out to these resources and counselors to learn how to have the conversation to say that there is a problem. And then the families really do need to step in more and when these things are going on early before those dollars are depleted, because one thing we know is that once it is started and that person has figured out that this is a good way to get money, they will increase it until the money is gone.
Great. Thank you all for that information. Danielle, you mentioned protective orders. Tell us the advantages of a protective order. You mentioned it has to be sought in the county in which...
I said a guardianship and conservatorship.
Oh, guardianship. Okay, I apologize about that.
Sometimes protective orders are necessary too.
Exactly. So let's talk about the
guardianship,
guardianship, but also a protective order and what advantages a protective order might have for a client.
Well, protective orders, sometimes we just need to get that person away from so that they can't come near them, and that mom or dad don't still have capacity, so we don't need a guardianship or conservatorship, but they are influenced by this person. And so once we can educate them and let them, again, if they can on their own go and seek, maybe with the help of a friend or some person from a different agency who can tell them that this is what you need to do to keep them away from you, one. And B, sometimes we need to change powers of attorney. That they'll have a power of attorney that they put in place because, I have clients who think he's my oldest son, so automatically he becomes the power of attorney. And I always say, we need, despite his 5 bankruptcies and, whatever else has gone on in his life. So, education on that. Again, the earlier people make those types of decisions over who they want to be their fiduciaries for them, whether it be a trustee, a power of attorney, and even an agent under an advance directive for healthcare, we need those people to be really good, responsible, kind people who won't take advantage of them. The earlier you do that in your decision-making process, the better. Because as you get older, and again, you may become needy upon that child, and so you automatically make them, and that child might just not be, they may be taking care of you physically now, but they're not the best person to manage your finances. They can't even manage their own, so that's real important. So getting a protective order is sometimes necessary, especially in a physical abuse situation. That's an absolute necessity. A guardianship, a conservatorship is what you get when somebody doesn't have capacity anymore, and you need to protect them. Guardianship is over their person. Maybe we need to remove them, because once you're their guardian, you can determine their domicile. So maybe we need to move them out of the home, move them in with me, or maybe I need to move them to an assisted living or a nursing home or someplace else. If I have guardianship, I can do that. Conservatorship is that I get control of the money. So if somebody's trying to bleed the money, once you transfer everything to a conservatorship account, that person can't touch it anymore. Now, neither can the ward or the person who's being abused, but now you're going to manage it for them, and you have to report to the court. So there's a level of transparency. You have lots of report. It is a hard job to be a conservator, and they have to report everything they spend and everything they take into the court. So there's protection there for the elder.
Great, thank you. One of the things I did not warn you about, I promised there'd be no hard questions, and I still don't think this one's going to be hard for you. But why are we here? Why are we talking about elder abuse and elder care? We know it exists, and we know that there's a need, but what statistics are there about our aging population that impresses upon us the need to spend some time focusing on these issues? Anybody want to start?
Well, I know there hasn't been necessarily a whole lot of hard data when it comes to scams in the elderly, but what we are seeing is an increase in the scams and a lot more complaints among our older adults. So we all know that, they go after the pensions, they go after the Social Security checks and all the other reserves that our elders have, and they're prime targets for a number of different reasons, that being one of them, but also because they see them as emotionally vulnerable, right? So we deal with isolation issues, and sometimes older adults just want someone to talk to, and they let them in and they share too much information. So we have a lot of those conversations about the emotional aspect to being scammed, because really it's a psychological tactic that con artists use. So those are some of the reasons that we get into it. Is because, number one, we know they're being targeted for the financial resources that they have. Number two, they are on fixed incomes. So it's even more critical that they save their reserves. So it's just so such an important issue and topic, because as we're talking about that, you're also talking about how it affects the caregiver, right? So if the parents' resources are dried up through these numerous scams and financial exploits, how are the caregivers going to take care of them? So it becomes a family issue. So that's why we try to have this as a family discussion.
Okay.
And I also think that the more we talk about it, the more it creates awareness among all generations, because we all age and we're all going to deal with an aging parent or loved one. So I just think that the more we know, the more power we have.
Great.
Absolutely. My mother, because of what I do, I tell my mother, who's 87, the stories of what goes on in my job. So she'll call me up and she said, the other day some guy called and said he was from the bank, and he just wanted to know my account number because he said that it was, illegally gotten into, and so if I could just give him my account information. And I said, well, if you were at the bank, you'd know my account information. I was like, good for you, Mom. So, the awareness of these scams are going on. Part of what I do, and I know the other services here do that, is we give out educational seminars to the senior population about what are the latest and greatest scams. Mm-hmm. Clark Howard's great about talking about them too. But, the whole sweepstakes and lotteries, there wasn't computers and the senior population wasn't on the internet 10 years ago, 20 years ago, so we didn't have to worry about that. But now it's so easy. It becomes, again, they're isolated, they're lonely, they get on there and they get an email and it sounds too good to be true, and in another time and place they would have known it's not too good to be true, but they want the interaction and it sounds really good, and maybe they don't really have a nice nest egg and they want to, I've had one client who said, well, I just wanted to leave something to my kids, and he was told that if he just sent this $60,000 wire to Jamaica, it was a Jamaican lottery scheme, that, he would get his $1 million, and he figured, well, my kids could really use that, and he did it, and then they kept coming back for more and more. They tell him it's the taxes. That's the scam. You pay the $60,000, the taxes, to get it out, and it's just so sad. It was his last bit of money, so then his daughter was left with no options for care at that point in time for him. So as he got worse, instead of being able to have more options to stay in the home, he unfortunately had to go into a nursing home on Medicaid. So those are really sad. But I think as A, our population's getting older, so we have more older people. Mm-hmm. B, I think there's a rise in dementia and Alzheimer's. So then there's more people who have decreased capacity, just diminished capacity, and then people used to live with their relatives as they got older, so there wasn't the isolation. Mm-hmm. But now everybody lives, I live in Atlanta, my mother lives in New Orleans. Thank goodness I have some sisters that live there near her. But if I didn't, a lot of my clients, they don't live near their mother. Mm-hmm. And so there's the isolation, and so that phone call from the whoever's trying to sell her something or the internet, they become their friends, right. They think.
Right. Okay.
I agree with everything you all said. And we know that about 70% of people with Alzheimer's or other forms of dementia live in the community. And we know that about 37% of those live alone and that they are at much higher risk. One of the areas that we're seeing a lot of problem with is abuse of the power of attorney that you all mentioned. And so in the next legislative session, we look to have a bill that will address improving the power of attorney laws in Georgia, also tightening up a little bit on the guardianship laws. But above all, we need awareness, because I think that AARP and some of the others have done a great job of increasing awareness of the fraud problem and what people can do to protect themselves. So I don't think any of us want to scare people. We just want to increase awareness so that people will be on the lookout for this and do the things you need to do to protect finances.
Great. Very good point. Thank you for stating that. We do just want to make sure people know what's available, what resources, and some issues to look for, particularly when you're caring for an elderly parent or loved one, or as we ourselves age. As we've pointed out, we all are going to age at some point. So let's talk a little bit about families making good decisions. If someone were to come to you, and again, each of you can take an opportunity to answer the question. If someone were to come to you and say, we're looking at hiring someone to help us take care of a senior member of our family, what advice would you give them in seeking out a caregiver?
I say, for one thing, a background check and make sure they're bonded. In this one case, I know of a woman who was quite wealthy and was just a little bit over-challenged in managing her own money, and they brought in a woman to assist her, and the woman helped herself to $38,000 out of her checkbook. And the problem was they didn't alert the bank in the time frame because the woman didn't manage her own checking account. And so by the time she knew there was a problem, which was when a check bounced, it was past the 60-day window where the bank would honor the funds that were stolen. And so I think totally background checks and make sure they're bonded.
And how do they get a background check?
Well, there are different companies that you can do that with pretty easily. Yeah.
Okay.
You want to make sure they're multi-state background, too.
I would definitely agree with that. I would always say that, the little access to finances as possible. Make sure you're putting those safeguards in place. So we always tell people, you can get a credit freeze, and usually when you're 65 plus, you can get it for free. So make sure you're freezing your credit. Make sure you're monitoring those accounts, checking to see if there's any fraudulent activity going on, and also be aware of what's going in the house and have those frequent conversations. A lot of times things just come out through dialogue with the one that's being cared for, that maybe something's out of place or something's missing, or they went to a place that they don't normally go to. So having those conversations usually brings out the necessary information that you need. So don't just put it totally in the hands of that caretaker. Make sure that you're on top of things as well.
I think both of you have said what we have constantly heard at awareness panels on gangs and child abuse and school issues is you have to be involved with your family members.
Yeah,
that's right.
So that theme is just constantly reiterated, taking care of others and being involved. So thank you for reiterating that. Danielle, anything?
I was going to say that, the stories that I could tell would all come about because nobody was involved and the caregiver was alone, and she was nice and she cared for somebody else's mom somewhere along the line, and that's how they got her, and they didn't really do too many checks. And people can change, circumstances in their life can change. So the caregiver might have been great, and then her son got in some trouble, or her husband lost his job, and then all of a sudden it just seemed easy to take that check or steal the jewelry or do whatever they're doing. So, but also in the physical abuse stance, if you're there, and I always say the squeaky wheel, you have to be there, because if you're there and you're monitoring and you're looking, then chances are likely that it's not going to happen. But when people are isolated, it's a lot easier to be abused. I mean, whatever age you are, that that's just an important thing to do. Also, if you can't be there, there's this fabulous thing called a geriatric care manager. Now, I know it's not cheap and you have to pay for it, but if you're out of town and your mom or dad, your loved one is in town and they have a caregiver and they want to be in their home and you have to be in California, wherever you are, there are great geriatric care managers that can come in and basically be your boots on the ground. And you can pay, their hourly and however much that you can afford, but at least it's another pair of eyes, and they can kind of monitor and make sure that your loved one is doing well. So I always recommend that for out-of-town clients.
Great, thank you.
I would just encourage the same thing these ladies have said, is to stay involved and don't be afraid to ask for help. Do your homework, check out the agency that you're looking at, and ensure those background checks are done. And stay involved with your loved one as much as possible.
Okay. Is the advice any different if a family is looking at like a group facility or a senior care living facility? How does that conversation change? Or does it?
Staying involved remains the same. I had an individual that I knew, they put their mom in a home, and within 1 week she was out. They did a pop-up visit, found that she was being bathed against her will by some gentlemen, and they were livid. Absolutely livid, particularly because they were, with gentlemen, and they specifically requested that didn't happen. So you have to stay involved, do those pop-up visits, have those tough conversations. But like I said before, one of the key things is conversation. I know we talked about diminished capacity, but sometimes things come out still. Don't just disregard that. Even though they may have Alzheimer's or dementia, things can come out in conversation that pose red flags, but you have to have the discussion. Don't just assume that they won't tell you anything or you won't get information from them.
I had a client who was living, her mother was living, dad had died, and her older brother, who had some substance abuse problems, was living in the home. And the mom, she would take the mom out to lunch, take the mom to the doctors, and at one of these times, mom said, I had the strangest dream that whatever his name is, let's just call him Billy. Billy's friends were over and they were in my room and they were naked. And that was just the red flag for her that something was going on. And that's when we decided it was time to get mom out of the home, that there was probably some weird things going on to protect mom. But just because somebody has diminished capacity, sometimes you can't quite decipher. But if your gut, like all my clients have said, my gut, when something bad happened, my gut told me something. And we got to listen to that, because usually that's a good sign that things aren't right. And getting non-bonded caregivers who, you get on I like to call it the black market, somebody who's just somebody's friend's friend from church or whatever. It's cheaper. It is cheaper, and you pay them cash, but there's no recourse against that. There's no, if you don't check them out, that's a danger. It's a scary danger to me.
Okay.
I agree. Most of the problems that we see in terms of abuse are happening in the unlicensed personal care homes. And the Division of Aging has done a beautiful job of putting policies and laws into place that protect the folks there. And they're working together with the GBI to go in and to shut down these places, because they're really just after the money that the seniors bring in through their Social Security and other benefits. And so I say do your homework, check it out, go in and visit. I agree with y'all totally. Be there regularly.
Stay involved.
Stay involved.
Stay involved.
And when you're researching long-term care homes, a simple web search may tell you a lot about a location. So I think homework and just involvement.
Great. Thank you. And we've talked a lot about resources and avenues that families can look into for care and protection and other resources, but some events or some incidences do rise to the level of criminal actions. And so we know that here in Cobb County, the Cobb Police Agency has a specific elder abuse investigator. The Cobb Sheriff's Office primarily investigates in their division fraud and financial abuse against the elderly. So we do have those criminal avenues here in Cobb as well, and each of those agencies do a great job with those. And then District Attorney Vic Reynolds is very heavily involved in the issues of elder abuse prosecution. We have 2 prosecutors in the District Attorney's Office who specialize in financial crimes and elder abuse. So we have those resources in place in Cobb as well to target those criminal actions and hold those offenders accountable as well.
And Cobb is one of the leaders in the state in that. There's only like maybe 5 counties that are close to that. And Georgia is considered to be one of the premier areas for addressing abuse nationwide. And so Cobb County is at the top of the list there.
Great, thank you. We're proud of our services here in Cobb, so thank you. Let's talk about, a couple of you have mentioned diminish or decrease capacity. We had a couple of questions sent in about driving, living alone, making healthcare decisions and financial decisions, and just all of the decisions that each of us make on an everyday basis, cooking, cleaning, things of that nature. From your perspective in dealing with the senior population, are there conversations that we can have with our senior loved ones when we see those diminished capacities occurring, but they may not see that? The biggest question is, how do you convince somebody not to drive? I mean, that's a common question, but that can also go to not to cook, you know, or not to walk down the flight of steps in their home, things of that nature. So run with that. Tell us what you would do with those types of questions.
We agree with you, and we think that driving is one of the biggest issues when it comes to Alzheimer's. And the challenge is that families struggle with knowing when it isn't safe for the person to drive anymore. And we want people with Alzheimer's, early Alzheimer's, to be able to drive for as long as it's safe for them to drive. But what we want people to also know is that the judgment impairs a person's ability a lot of times to discern whether or not it's safe for them to drive. And so that means that the family needs to provide some oversight and some guidance. And we actually gave scholarships for 30 people with early stage to really see what was going on. And 11% of the folks passed outright. 40% failed outright, and the remainder were told by certified driver rehabilitation specialists that they could drive under certain conditions. No rain, no expressways, no fog, no snow, those kinds of things. But from there, we like to tell people, if you can afford it, if you're concerned, to go to a certified driver rehabilitation specialist. And if not, you need to at least be riding with the person and see how they do with changing lanes, stopping at the lights, stop signs, how they're doing on speed, etc. Ride with them. And finally, that there is help. I know we do counseling, one-on-one counseling to counsel the caregivers on having the conversations. And we also have a class called Conversations, so you kind of nailed that one. And the main thing we want is for people to help them find other alternatives. So if it's important to go to church, then how do we get that person to church? Mm-hmm. And so we want to make sure that the needs are met in the most gracious way as possible, but maybe from a safety perspective. Yeah.
And, sorry.
Oh, that's okay. No, I wholeheartedly agree. I mean, we get asked that question all the time, and we have a driver safety program that we offer just so that older adults can continue to sharpen their skills when it comes to driving. But it's one of those questions that you want to preserve independence for them as long as possible. And I think you hit the nail on the head when you were talking about alternatives and options. And I think that's a huge conversation when you talk about just how we do our city planning, because we're having that conversation. How do you provide alternative transportation for older adults to get around? Because if not, then you do run into those isolation issues. So it's something that the family has to have the conversation, but also we as a community have to have the conversation. So that's pivotal. I know that for my aunt who has dementia, Alzheimer's, it was a tough conversation to have. And I think, you have to have the conversation not only about their safety, but about the safety of others.
Right.
And I think once they start seeing that full picture, it kind of softens that, but you have to add that extra cushion of the alternative. So giving them the alternatives is key.
May I just add on a practical note that once we've decided that it's time to give up the driver's license, you cannot leave the car in the driveway because they're going to not remember or be tempted or something that it's time that they can drive again. And so that it's just dangerous to have the car. So once that decision has been made, hopefully with everyone in agreement, then the car and the keys need to go. The car and the keys, because I've actually had clients who went and called the dealership and got new keys made. I've also had them call and get the car fixed when it was, so you just need to get the car and the keys out of there when that happens to avoid danger. Temptation and the danger that will probably ensue from that temptation.
And from another practical standpoint, you also can't rely on them not passing their driver's test, because my grandmother at 95 who can't see and can barely walk passed her driver's test.
Somebody thought they were doing her a favor.
We
In
told
those
them to
kind of
not.
cases, we really say to families, let the doctor be the bad guy. You know, let the doctor be the one to write a prescription that says no more driving. And I think a good doctor is happy to do that. And we have that happen a good bit.
Well, I know from experience that conversation is a very hard conversation to have. And I do think when you do have that conversation, it does, like you said, help to soften the blow. If you can, you know, we can't do this anymore, but this is how we're going to solve this need. And in senior services, we offer a variety of services for the homebound senior, all the way from personal care to homemaker services, respite services, transportation, to doctor's appointments, to some of our facilities for programming. So I do think it's important when you do have that conversation to really research what your options are and your alternatives are for your loved one.
And especially in a county like Cobb, where we're pretty wealthy in resources.
Yes.
And pretty wealthy in services that we provide in our community. So chances are your need can be met with a little education and a little research.
Correct.
And if not, then we'll call senior services and say, hey, have you thought about this program?
I like it.
Let's talk about safety in general. As our bodies get older, and our minds get older as well, you know, sometimes we just have diminished capacity for physical ability as well as mental ability. The world today is just different than it was 50 years ago. So let's talk about having a conversation about safety, keeping your doors locked, not leaving your purse, you know, in view, things of that nature. Do those conversations differ with seniors than they would with anybody else?
Well, the problem is that once somebody has diminished capacity, you can have all those conversations in the world today, and we might have to have them again tomorrow and the next day or the next hour. And so they're not going to remember the way that I don't remember the way I did when I was 16. And I'm probably going to remember less when I'm 65 or 80. But, you know, so that's part of the problem. You know, yes, you need to, you know, watch the stove and, you know, what you put on the stove, of course. And I think that, you know, a lot of the education about dementia is that caregivers and loved ones get so frustrated because I told you that, I told you it was going to happen, and that just doesn't do anybody any good. So the ideal thing to do once somebody truly has, you know, we want to keep them as autonomous as possible for as long as possible. We all want that. But when it's not safe anymore, we need to put systems in place to protect them. You know, if they're leaving the burners on the stove, it's time to, you know, maybe get them out of the house or not have them alone or have a caregiver in the house or something. You know, once it's become dangerous anymore, if they can't get down the steps anymore, it's time to get them out of the 3-story house. You know, they just like can't drive, you need to get the car away. Just those types of things. When somebody loses their executive functioning, when they really can't process how to use a phone or use a washing machine, we can't expect them to do that anymore. They just can't. And yelling at them or telling them every day or calling them up on the phone, unless you want to call them up and give them step-by-step instructions every day on how to do everything that we do every day without thinking, and it's going to drive you crazy. it's time to put some systems in place.
Okay.
Even our older adults who don't have diminished capacity, we find that there are issues with trust, them being a little bit more trusting than we would normally be. And so it's hard to have that conversation, but you do have to make them aware of what's going on without trying to frighten them, so to speak, but making them aware about certain criminal activity that may be taking place, how to best safeguard themselves. I know we talk a lot about caregivers having alarm systems and, you know, making sure that they're not just opening the door up to anybody and having those basic conversations that you and I would say, well, of course, we would never do those things. But it goes back to that trust level and that relationship that con artist or whoever it is trying to build with them so that they can open the door, so that they can stay on the phone longer, so that they can take advantage of them. So learning how to safeguard themselves, you have to continue to do that, but also making them aware about the certain crimes that are going on so that they can protect themselves.
That's a great point. From the Alzheimer's Association, the biggest risk that we see in terms of safety is wandering. And each month we work on about an average of about 10 missing persons across Georgia, and about a third of them are driving. And so what we want people to know is that people who have Alzheimer's are at risk for wandering. We estimate about 70% of them will wander some point throughout the disease. And so we want people to be really aware of the driving issue, and then to be aware that wandering does occur, and that if a person does wander, to look in the area immediately inside and outside of the home for about up to 15 minutes, and then to call 911 and ask them to implement a Maddie's call. Because if they do that, we can find them in a timely manner. If they're driving, it's probably going to entail having their information about their car put into systems like the BOLA, as well as the National Crime Information Center database. If they're walking, we might bring in canines, but it's important to address that in a timely manner. But I will say from there, I totally agree with what you all said, that we want to meet the person where they are. And if they're okay on their own, fine. But if they're isolated, that's when they're going to be more likely to let in strangers that don't need to be in the home. Mm-hmm. So meet them where they are, and if there are unmet needs, if that roof isn't repaired and you see that it needs some help, step in before they let whoever knocks on their door do it.
Great and you point. May want to invest in a nanny cam. I mean, it would put your mind at ease, especially when we talked about long-distance caregivers, right? So you're not there. You know, you can't get there right away, but just to be able to monitor and see what's going on would put the mind at ease, and for you to be able to respond appropriately.
Great. There's also some lovely, instead of, you know, for the wanderers, or also a life alert for people living alone is always good, because if they fall not near a phone, you know, they can just press the button. But also my partner's mother-in-law had Alzheimer's early onset, and she was wandering, and they got what they called it LoJack Fanana, but it was just a bracelet, and so they knew where she was at all times, because they had lost her one time. She had wandered, and that scared them. And so there's pretty jewelry you can get, so it doesn't have to look ugly and it doesn't have to be embarrassing, but it was a piece of jewelry, but it kept so they knew where she was at all times.
So there are resources out there. We just have to know where to look and how to find them.
There's tons of resources out there. Mm-hmm. There's also resources to get your home, safe for you to live in. Mm-hmm. There are actually companies that can come in and do everything from putting a bar on the shower to looking at your house and telling you of inexpensive and really sometimes not at all, just take the rug out, so to avoid the tripping, and things to keep the house more accessible so you can live there longer. Yeah. And not have dangers.
Senior Services has a program, Share the Care, that actually addresses some of those issues for caregivers that are caring for a loved one with dementia or Alzheimer's. This program helps to share the cost with installation of some equipment, such as grab bars or safety equipment within the home, to help them to age in place and stay longer.
Yeah, and we also have the same thing too, where we provide education on home fit. So we have a home fit workshop coming up in October where we'll have people do a home fit assessment to see what exactly they need to change in their home so that they can age in place, and some of the minor things that they can do that are cost efficient, and then some of the major projects they may want to think about long term. But yeah, that's definitely important as well.
So while each of you mentioned a couple of things about those services, let me remind you and our community that we do have an elder abuse task force that meets here in Cobb County. They are very active in the community. And one of the great things that the task force does is sends out through our distribution list information. So if you have events coming up, the Neighborhood Safety Commission can share that as well. But if you have events coming up, please share those so that we can get those out in the community. And help educate people and advise them of what resources are available to them. That would be fantastic. While we're talking about safety in physical dwellings, one of the questions that we had is about building. Mm-hmm. What, if anything, exists in Cobb that might require a builder who is building a property specifically for seniors? Are there building codes? Do we know?
I do not have a depth
Okay.
of knowledge in building codes.
Well, we know that the Americans with Disabilities Act
Correct.
exists. And so does anybody have any information about building?
It depends on what you're talking about.
Okay.
In what we now call assisted living communities, to get a license to be in a community, there's lots of different building codes that they have to have, mainly to have fire safety. I don't know what they are, but I know there's a lot more. So a lot of the assisted livings are now licensed under the personal care home and not the assisted living license anymore because they couldn't meet that code. By being an assisted living community, you're able to do more things for and help them to age, basically to stay there until they die. Assisted livings, if they can't help in their ambulation, then they have to leave there, and so that's basically the difference in that code. But it's mainly fire, lots of more fire safety.
Okay. And I know that Cobb County's zoning site is very detailed, so I'm sure we could research that and get that information. I want to talk about HIPAA. A couple of things that have been mentioned about staying involved and having discussions about health care and issues. How has HIPAA changed that, if it has, in us being involved in our family members' health care discussions with their physicians?
Well, I'll just say that any client who comes to us and we execute a HIPAA authorization so that their advanced directive agent, who is their healthcare agent, would be able to talk to the doctors, and we have them sign that then and there while they have capacity and can sign that, so that we don't have to worry about the HIPAA laws, because you're right, some doctors will not discuss issues with the family because of HIPAA laws and being afraid to get in trouble about that.
Anybody have anything to add about that? Okay.
I would like to just say that I think it's very important that seniors get clear in their minds who they think would look after their medical health the best. So, like you mentioned earlier, you don't play favoritism like my oldest son. You really give it some hard thought in terms of who would look out for me best. And then make sure that those names are in your medical legal documents, but also make sure your doctor has them listed on your HIPAA agreement, that they can share that information. Oversight with a family member you can trust is a good thing, but if that person's name isn't on it, the doctor's not going to share it. So give it some thought.
Great, thank you. So let's say someone comes to you and says, I want to put a plan in action that I'm taking care of in my older life, and everything that I want and need is spelled out, including funeral arrangements, banking issues, care issues, things of that nature. What is that conversation? How do you tell them to prepare for that? What kind of kit do you tell them to put together to have the necessary documents or plans of action in place so that they can take those steps?
So I know we have a long-term care education program, And so one of the things that we do is we take it in 4 parts, actually, because people need to look at it holistically. So from your home and your community, is that really a community where you can age in place? Does it have a pharmacy nearby? Does it have accessible transportation if you do become immobile? So all of those things are considerations to see if that's a place where you really need to be. Also with your home, does your home have the necessary things in place? And then we go and we cover finances. So we talk about the cost of long-term care and who's going to pay for it, how it gets paid. So, you know, we dispel the myths about what Medicare is going to cover and what it's not going to cover. And then we go into the wishes. So we go into that power of attorney. We go into that advanced care directive. And then we talk about, you know, the will. But we also go through those questions as to what are the things you should be considering when you appoint these people. So some specific things that you should be looking for. So it's really quite eye-opening for many people when they really take a look at it, particularly the home and the community. And then we talk about the health. So we talk about your health as well as, are you leaving the necessary documents to your family? So healthcare history. So people don't know that they can actually go to a website to log the history of their health, so that you can leave that for family members, because that's important to have as well. But we just try to approach it holistically, so people are giving their families a comprehensive view as to what their wishes are and what they want to leave behind.
And early planning.
Exactly, and getting the whole family involved. The program is actually designed to where you take 40 days to do these things and put it in place and then hand it off to your family, so you're sharing it with them.
Wow, I wish I had more clients who did that. That'd be fantastic. And, you know, whenever we have a meeting, when people call into our office who want to come in and do some planning, we always say, they're like, can I bring my family? I'm like, the more the merrier. I like to have those discussions. I was telling you earlier, you know, I believe that people with nothing to hide nothing. We just need to be open and honest about, this is what my plan is. Let your kids know. I can't tell you how many kids, when they read mom's advance directive and find out mom wanted to be cremated, they're shocked. You mean she doesn't want to be buried with grandma, blah, blah, blah. And, you know, so I always say I love the advance directive, but it's an opportunity for discussion. So when they come in and they want to start planning, these are discussions we can have with our kids. Or if we don't have kids, with whoever it is that, you know, we want to take care of us as we age. A lot of people, I think, are just in denial that they're just going to, you know, one day their money's going to run out, they're going to go to sleep, and they're going to die, and, you know, it's all going to be taken care of. That doesn't happen. You know, it might happen for, like, I don't know, one person. But the rest of us, there's going to be some problems, some glitches, something along the way, and we need to think about that. And the earlier you think about it, the greater your options are. The more you talk about it with your family, the more comfortable they can be with that. You know, the wrong time to talk about your dying wishes are when you're dying. You know, the worst time for me to have to do a will is when I have to go to a hospice to do one. And unfortunately, sometimes I'm going Saturday morning because we don't think she's going to make it to Monday. And I'm always shocked that we're waiting to that point. But a lot of people just don't want to deal with those hard issues. And as I say, we're all going to die. The question is when, so we might as well plan for it now. And we can make much better decisions, and we can think holistically about it when we're still healthy and we've got all the options ahead of us. So that would be my prayer for everyone.
And in our multi-purpose centers with senior services, we do offer educational seminars on this topic that, and it's just a time to get together and talk about what this should look like. And some of the things you do need to talk about, like with your health and your power of attorney, that type of thing. So
we've talked about some heavy stuff. Allison, tell us what fun things the senior centers offer so that our seniors know that it's not all about preparing and planning and making all these decisions. What kind of fun things can they do?
We have so much going on. We have a total of 8 centers around Cobb County. We have what's called a multi-purpose center, and we offer all kinds of activities, day trips, to local attractions around Georgia. We offer computer classes, art classes, Tai Chi, yoga, all kinds of exercise classes for the active senior 55 and over. I do have, I brought, and on the back table is a blue booklet right here that will give you information on all of our facilities. But we have a lot of fun. On October the 13th, we're going to have a Taste of Wellness that's going to take place at our senior wellness facility at 1150 Powder Spring Street. And you can drop in between 3 p.m. and 7 p.m. To experience our Tai Chi, line dancing, creative arts, play around with an instrument, take a tour of our workout central. We have a workout facility strictly for seniors. We'll also have some health screenings, and you'll get to taste samples from our new cafe that is opening later this year. So I would encourage everyone to attend that.
Very good.
I always love when I give seminars there, and I always love when I go in there. It's a very vibrant place to be. I like it a lot, and everybody seems to really be enjoying themselves.
We also have neighborhood centers around Cobb County that provides transportation for seniors that are maybe homebound to come to those facilities. They also take day trips. They also have lunch served daily, and they have exercise classes, much the same programming as what you would see in a multipurpose center.
Very good.
So
Thank you. I have two more heavy questions, and I think Danielle's probably the most appropriate one to answer this. If anybody has anything to add, you're welcome to add in. As you said, we're all going to die. I'm sure that you've seen cases where there's been no directives put into place. There's been no decision making ahead of time. What if the family has nothing? Are there services or resources in place that will help with burial expenses, funeral expenses, things of that nature, particularly if it's a natural death? Now, certainly if it's a death because of a criminal action, there are other options, but natural deaths, are there options for that?
It depends if they're a veteran. The veteran services have some small type of services in place, but generally speaking, no. I will say that there are cremation societies out there that will do cremations, because we've had people call and they're like, "Mom died, we have no money. What's the cheapest way we can bury her?" And the cremation, there's several crematoriums that will do it for like $750, but that's about the best that we can do. And when that happens, I'm not sure. Do y'all have any programs in place for that for seniors? I'm not sure.
we do not have any programs within senior services, but we do have an information referral line that I'd be happy to provide, but that you would be able to call and perhaps get information on community services.
But usually, if there's no advance directive in place, the doctors would look to the next of kin. The problem is that if you have a spouse, your spouse is your next of kin. Your spouse may not be able to make those kind of decisions because they may have diminished capacity, or you don't have a spouse anymore, which is a case in a lot of my clients. And so then it's adult children. But as I always say, it doesn't say kindest, prettiest, smartest, wisest. It's adult children, which means they all get to make the decision together. And if they don't make the decision jointly, the doctors are generally going to go with keeping someone alive. And that's not always the best choice to make. And I've had lots of social workers from hospitals call me going, "What do I do? I've got kids fighting and, mom's on a vent, and what do I do?" It's not a good situation to have. So advance directives, you can get them online. They just need 2 witnesses. It does not need to be notarized. There's absolutely no excuse for any of us not to have an advance directive in place. It's also the place where you can say whether you want to be buried or cremated. The will is not the place for that, because when people read the will, that's already happened. So it has to be an advance directive so that your agent gets disposition of your body, and then if it says buried or cremated, then they get to decide what to do there. So that's real important to have in there. There's also a place where you can pick who you want, if you need a guardian, who you'd want it to be. So an advance directive is a wonderful document. It's free. We should all have them.
And we'd like seniors to know about the PULSE too, which is a physician order for life-sustaining treatment. And we found that a lot of times when it came to people with dementia, that sometimes those were ignored, advance directives were ignored. So we wanted a legal form. And with this, it puts the physician order, makes it a legal binding medical document. And so the wishes of the person would have to be honored.
And tell us the name of that document again.
Physician order for life-sustaining treatment, called a PULSE. And it is generally designed for, we passed the law to make it available here in Georgia because of that cause. And a person with dementia could do it at any point in their life. So newly diagnosed is when that needs to happen, so that the person has done it before they lose capacity and won't be able to do it. But for other seniors, it's generally for the last year of their life under the new change in the law.
Great, thank you. So we're getting close to our time for wrapping up. I want to take a few minutes and turn it back over to each of you. If you want to just kind of close out for us whatever you haven't said about your agency or about the issue that you want to push out into the community, now's your time to do that. Allison, we've started with you a lot, so we'll start with Jenny this time.
Okay. I would just like to say that the Alzheimer's Association is a resource for people that are concerned about their memory or newly diagnosed or their caregivers. They can come into our offices, or any information you could want about Alzheimer's is online at www.alz.org. And then I also want people to know that if they're concerned about Alzheimer's, to get engaged with us as a volunteer or possibly as an advocate. I know that we've done great things with partners like AARP and all the others in changing the laws and policies, and we invite seniors to be part of that.
Great, thank you.
I would also say that you can definitely be active with AARP Georgia. We have volunteers across the state, and we are always looking for more to advocate as well as educate communities on issues such as caregiving. Fraud is a huge topic, financial resilience, long-term care, and others, and also helping communities prepare for an aging society. That's a huge part of the work that we do. Just to give you some more information about fraud, for those of you who just want additional information or think you have become a victim, please visit aarp.org/fraudwatchnetwork, or you can call our toll-free line at 1-877-908-3360. And these are free resources. So everything that we do, we offer to the community for free. We will come out and do free workshops, as well as train you to do free workshops. So please come visit us, and you can also call me if you want to become a volunteer at 404-870-3785.
Hi, my law firm, Hurley Elder Care Law, my partner and I are both certified elder law attorneys. We're 2 of 10 in the state of Georgia, and all we do is elder care law, and we care a great deal about the senior community. If you have any questions, you can always call our office. We know of lots of resources in the community. When we can't help people, we're constantly giving out numbers and websites and other people's information that we can help our senior citizens, because we get calls from everything from where's the closest Target pharmacy to, how do I get a will in place? And we try to help them with every question that they ask, because I realize that most of them do not have a computer sitting in front of them when they call our number. So our number is 404-843-0121, and it is always available. We'll take any questions anybody has. We're happy to help the senior community in any way we can. But I guess my biggest concern is that people need to plan, because if you don't plan, then you run out of options and bad things can happen. So planning is the key to making your senior years. And then once you've planned, you can kick back and say, I've done everything, now I can just enjoy. So it's just something you can check off the list.
And Cobb Senior Services offers a wide variety of activities, services to seniors at all life stages. You can go to our website at cobbseniors.org. We also have an information and referral line at 770-528-5364 that will be able to give you any information that you need on services available, not only with our agency, but also within the community. On October the 21st, we're having a Fearless Caregiver Conference at our senior wellness facility again at 1150 Powder Springs Street. It's October 21st from 9 to 2:30. And this is not just for seniors. It is for caregivers of all ages. And I believe caregivers caring for people of all ages. So it's going to be a great conference, give you a lot of information. So I would encourage you guys to come and check us out.
Great, thank you.
And we would love support at our Walk to End Alzheimer's, which is coming up on 2 Saturdays from this week on September the 23rd.
Great, thank you. Again, if y'all share that information, we will make sure that we distribute it throughout the county. 2 other resources, excuse me, in the county that I want to make sure that our audience is aware of. One is, of course, we've mentioned the Elder Abuse Task Force. That's a group of organizations that meet periodically to address financial, physical, and institutional abuse of seniors. It's a very active task force. They do training, they do education, some case review, involved in a lot of different areas. So that's an area that the community can become involved in as well. And then Cobb has been fortunate to be awarded a grant from the federal government to address issues of abuse in later life, primarily intimate partner abuse, but we do know that financial abuse comes with intimate partner abuse, and it's kind of all wrapped into one. So that is a program that is a partnership through the YWCA, the District Attorney's Office, and Cobb Police, and there is a specific elder abuse advocate on staff there that is available to answer questions and provide resources and information. So 2 other resources here in Cobb. Again, we have a lot of resources. For those of you who may be watching who say, I don't have access to a computer, there are plenty of phone numbers that we've given out this evening, or you can always call the District Attorney's Office if nothing else, and we can refer you to the proper and correct agency. So please know that we'll get help to you and information to you. However, we need to be able to do that, not just through the internet, although that's the quickest and easiest way usually to share that information. So personally, I want to thank each of our panel members for being here this evening. It's been a pleasure to learn about your agency and to learn about the information that you have to share. Thank you to the Neighborhood Safety Commission for sponsoring our panel again, and I'm going to turn it back over to Trish.
Thank you. Thank you for attending and watching on TV 23 this evening. We especially want to thank our dynamic panel members and moderator. We are honored to have each of you as our moderator and panel members this evening. Our community is very fortunate to have each of you educating the community concerning senior safety and senior issues. We commend you for your daily dedication to protect, support, provide care, services, assist with legal issues, and programs for the senior citizens of Cobb and their families who are experiencing health and aging issues. You are appreciated, and we thank you for your daily service to protect and keep seniors safe. A special thank you to David for broadcasting this discussion on TV 23. Thank you for joining us this evening. We invite you to watch all of our 2013 and 2014 and 2015 panel discussions on the Cobb County TV 23 website or link from the Neighborhood Safety Commission. Please join us Wednesday, October the 21st at 7 p.m. when our topic will be domestic violence and domestic abuse. Thank you. Good night.